as we said before, entering this next phase of the pandemic, empowering prevention. People can take steps to prevent, take that personal responsibility for prevention, monitoring trends, moving away from just cases and percent positivity to really looking at hospitalizations and deaths. We are seeing for February, though, we have seen quite a few deaths. We started the month at 692 deaths. We're now over 750. So even though this is the shortest month of the year, we do anticipate this is going to be one of the largest number of deaths. A lot of that is, lingering from people that have had COVID now for several weeks or several months. Also, the three things going forward is vaccines. Obviously making sure you're up to date, that you have, even if you hadn't got a vaccine at all, there's still, now is a great time to get the vaccine, especially as mask mandates are lifted, really encouraging people, to get that vaccine. You're going to need that now more than ever, making sure you're up to date on boosters. Obviously encouraging people to mask when they deem appropriate, if they feel they need to be masked, whether it's who they're around, the crowd, the location, or their health status, and look at the type of mask, such as the N95, which offers the most protection, and then testing, encouraging people to get tested if they have symptoms or are in contact of someone. We encourage people to, just because it's not mandated to wear a mask, that you can still wear a mask, and you should feel comfortable wearing a mask if you want to. And I would encourage people that even if you don't wear a mask, don't hold that against someone that does wear a mask. And I think, and two, you may choose to wear a mask in some situations, but in some other situations not wear a mask. If you are in maybe you're in a large store that's got very high ceilings and it's not crowded. And maybe for that circumstance, you feel comfortable not wearing the mask. But then you're in your office building, or you're in a location where you're going into a crowded elevator, or you're in a crowded space, and you feel more comfortable wearing a mask. So I think those are things that, some people are going to not wear a mask at all. Some people are going to not take off their mask, and then some people, I think, are going to be in the middle, where they choose to wear it in some places and not wear it in other places. So I think it's another thing is, I know that with the metrics, we don't expect like this cases to go up as soon as mask mandates go away, because we know that there'll still be people wearing masks. We still know we have a highly vaccinated population. But we still encourage people, like you said, to take those precautions, whatever they feel is best for them, and also looking at their health status and the health status of those people that they're around. Maybe you're healthy and you feel fine, but you are around individuals, parents, grandparents, coworkers, people in your church or wherever that have compromised health, and you say, hey, maybe it's best because yeah, I'm vaccinated, but I don't want to accidentally be asymptomatic and give it to someone. So, those are really some of the things we've always told people to do. It's just there won't be necessarily that mandate. Back in June and July, there was that brief time period when the cases were very low, even lower than we were only seeing 40 cases a week. And at that time, if you remember, the mask mandates were lifted. And it was kind of interesting. It kind of felt almost awkward at times not wearing a mask during those times. So that's something, just like we had to get used to wearing masks. In some places, we're going to have to get used to not wearing them if we choose to.